This Good to Go segment is sponsored by Spectrum Health Medical Group.
Do you have varicose or spider veins? If you do, you probably have questions about exercise and whether it's safe and which exercises are best for maybe slowing the progression. And what about an athlete? Can they possibly have varicose or spider veins? Dr. Jennifer Watson is from the Spectrum Health Medical Group Vein Center, and she is here to talk about the importance of maintaining healthy legs and an active lifestyle. It's good to see you, Dr. Watson.
It's great to be here. Thank you.
Yeah, what causes varicose and spider vein? Are they the same thing?
So they are caused by the same process, but they're a little bit different, meaning that they both have to do with faulty valves on the inside where the blood is pooling or not being cleared correctly. Varicose veins, we typically think of as bigger, causing more issues or symptoms, maybe some swelling, some aching, whereas spider veins are those unsightly ones that we may not like the appearance of, but they tend to be smaller and flatter and don't really affect the function of our legs.
What causes this?
So there are a lot of different causes. Sometimes it's just kind of bad luck. They can be genetic, they run in families, but it can also be caused by inactivity, being a little overweight, pregnancy can cause these. And so there are a lot of different causes of spider veins. I think what we're seeing a lot now is just the inactivity, because unfortunately with COVID, people have been home a lot more. You know, we're sitting at home now, working from home, not being as mobile. So it's a lot of inactivity these days.
So does that mean that an athlete, somebody who is active, can't get spider veins?
It doesn't mean they can't, because unfortunately they could still have those bad genes, or maybe they've had multiple pregnancies, but it definitely helps to be more active, because the more active you are, the less chance of those larger medically necessary veins coming up. And you know, any inactivity is going to worsen things. So if you have a few, they may get worse with inactivity.
So let's get people active then. What kinds of exercises are good for staving off vein disease?
Yeah, so what's really good is anything that makes your calf muscle squeeze. In medicine, we call it the calf muscle pump. It's this really important group of muscles that squeeze and clear the blood. So if you think of that, then you'll kind of know what to do. So running, walking, elliptical, swimming, biking, anything that squeezes your calf muscle. Sometimes people tell me, hey, doc, I really can't do those things because of my other medical issues. If they can at least do toe ups, where they flip their toe up and tap, tip, flip and tap, you kind of feel that calf muscle squeezing, you know you're on the right track.
Can you prevent varicose veins?
I think to some extent you can. I mean, there are circumstances where you're not going to be able to, you know, if you're pregnant and you get some from that, that's kind of the way it is. But you can definitely prevent things from getting worse if you already have them. And you may be able to stave them off completely if you really keep as active as you can, try to maintain a normal weight, use compression socks, especially if you're sitting or standing for prolonged periods. You know, the veins often reflect what's going on in the body. So the healthier you can keep yourself, the healthier they're going to be.
What about treatment?
Yeah, so if you are unfortunate enough to have these, or you've kind of tried all these measures and you still have them, there are definitely treatments that can be done to eliminate the faulty veins. Usually starts with an ultrasound where we find out what's going on and what they're connected to. And then there's a series of things that can be done. Usually they're just done in the office. So these do not have to be big invasive procedures like they did, you know, 20 years ago.
Yeah, all right, good news then. Well, for more information, folks, you can contact the Spectrum Health Medical Group Vein Center. We have put their contact info on our website at 13onyourside.com. Dr. Watson, thank you so much for being with us.
Oh, thank you.